Hi guys, it's Vanessa Liu and welcome back to the Perfectly Imperfect HOSA podcast. Today we have Dr. Grasser for episode 3.
Hey, Dr. Grasser here. I'm with Vanessa Liu, and we're very grateful to our friends over at the Brainstem podcast for letting us hang out in their digs today.
Yeah, thank you so much for having us.
I'm currently an assistant professor here at Wayne State University, and I'm also the director of the Ruby Resilience Lab, where we study child and adolescent brain development.
What research do you do here at Wayne State?
Yeah, so my research is really focused about learning about this process of resilience. So how we're able to respond to and grow through challenges that we might face throughout our lives. I study this by learning about both negative and positive experiences that youth may have faced and how that affects their mental health, feelings of anxiety, stress that they may face, and how it changes their brain development and the way that their nervous system perceives and responds to the world around them. To do this, we use tools like neuroimaging. So if you've ever had an MRI, maybe from a sports injury or something like that, we use that same tool to take pictures of kids' brains and learn about the structure of their brain and the function. And we also use psychophysiological testing, which is a mouthful of a word, but really it means doing things like using an Apple Watch or other similar wearable devices where we can measure things like your heart beating or the sweat on your skin or the amount of movement that you might do in a day to learn more, again, about how your nervous system is functioning in the world around you and how that might be informed by your experiences and what we can do to intervene in cases where someone might be struggling based on their lived experiences, learning from what helps those kiddos who are resilient.
Amazing. And can you also talk about what got you into this and how long you've been doing this for?
Yeah, so another arm of the work that I do really focuses on the intervention end. So what can we do to help those individuals who might be struggling? And we've seen that for a lot of kids, having a hobby, having some skill that makes them feel that sense of mastery and community is beneficial. So some of those interventions we study are creative arts and movement-based techniques. And that was actually how I got into this field. I was studying in college at Michigan State University and taking a health psychology class. And we were asked to think about a challenge in our world and what is a way that maybe a lot of people might be aware of that we can use to address that challenge, and what is a tool or another process that could be used to address that challenge that not as many people might be familiar with. And that's when I discovered dance and movement therapy. I myself was a pre-professional ballerina and a professional choreographer before I got into the field of neuroscience. So I had personal experience with dancing when I was a teenager and having that be an outlet for me and my stress and my anxiety. And I always felt, well, why couldn't this help somebody else like me? And so through that course, through that assignment, I learned about this field of dance and movement therapy. And I learned that while we know we have the lived experience of an activity like this helping us and helping enhance our quality of life and our positive emotions, there wasn't as much research in this area as there might be for talk therapy or for medications that we might use to help somebody who's struggling with their mental health. And we need that research so that insurance companies will fund it, and even so that maybe schools will adopt programming in their schools to support teens like you and like your listeners. So that's the work that I embarked on, and in order to lead that line of research and what I previously talked about learning about resilience, I needed to get a PhD, a doctoral degree, so that I developed the skills of how to design a research study, how to conduct data analyses to interpret the findings that we might gain and put them into context and disseminate that information out into the world. So I did my PhD right here at Wayne State University in the Translational Neuroscience program, and it was a fantastic place to train because we're so integrated with the community, and I got to work with a lot of kids from around the Metro Detroit area, which was a really enriching experience.
So can you talk more about what is happening in the brain when you're feeling anxiety and stress? Because our page is dedicated to perfectionism and the fear of failure. So can you talk more about the brain and what's going on?
That's a great question. So what happens when you're feeling these maybe feelings of imposter syndrome or feelings of failure or not as good as everyone else? These are all psychological stressors that we experience, right? And what happens with the psychological stressor is actually the same thing that happens to us with a physical stressor or danger that we might experience. So your brain is taking in all of this information, you're layering it on with all of your previous experiences about what you think it means to be perfect or what you think it means to fit the standards of society today. You're looking at Instagram, you're thinking, why is my life not like this other person's? You're looking at your grades and you're thinking, I wish it was different. What could I have done better? And all of these signals go to an area of your brain that's called the amygdala. This is the part of our brain, it's known for something called salience detection. So it's basically responding and alerting us to anything in our environment that might have significant meaning. So maybe this is, I'm really stressed out right now because I'm not feeling perfect. I feel like I'm failing. This is really upsetting to me, and that's taking up all of my attention and focus. It could also be, I'm really happy and excited about this. I'm gonna go to Dairy Queen with my friends and I'm really looking forward to that. This amygdala is taking in all of that information. And what it does is it talks to the other parts of your brain. It tells that frontal cortex that we were talking about regulating itself. There's other parts of the frontal cortex and the parietal cortex, another part of your brain, that help us allocate our attention. So it's telling these other parts of our brain, hey, pay attention to whatever this important thing in our environment is. So now I'm fixating, right, on what I'm seeing on Instagram or those grades or whatever it might be. Then it tells the hypothalamus and the brainstem, so two very old parts of our brains that are very important for regulating all of our bodily functions. It tells these parts of our brains, we're stressed. We need to mount that evolutionarily conserved stress response, the same one we have even if we're being chased by a bear, for example, or we're being exposed to extreme cold. Those parts of the brain are going to tell our heart to beat faster. They're going to tell our skeletal muscles to activate so that we're kind of ready to run away or to fight or whatever the response might be. They're going to increase inflammation. As again, we're mounting the same response to these psychological stressors as we would to physical stressors. So the body's preparing. What if I got infected? What if my skin got damaged? I need to be ready for that. And then shortly thereafter, we also secrete cortisol. So that's stress hormone that you've probably heard about. And that's there to kind of help us respond to the stressor and then reset back to that homeostatic level. So we have all of these changes that happen. Our heart's beating faster, our breathing might get heavier, and we can perceive that, right? And when we feel our heart beating faster and we know that our breath is speeding up, that in turn may consciously cause us to feel very anxious. Oh no, what's going wrong? Then we kind of spiral, right? And now I'm feeling anxious because of this sensation in my body. That psychological stress is feeding back, right? And for some people, they may then experience something like a panic attack and dealing with these psychological stressors. And it's all because the same system, again, that responds to psychological stressors is the same one that responds to physical stressors. So what can we do in these situations? Well, again, we're going to use that deep diaphragmatic breathing technique to activate our vagus nerve and to tell that fight or flight arm of our nervous system to quiet down and to help ourselves go into that restful and relaxed state. We can also remind ourselves with cognitive exercises, hey, I'm in a safe space, I'm surrounded by my friends and family, they're gonna support me no matter what my grades are or how I'm doing in school or in my social activities. We can remind ourselves, hey, this test, it's not the only thing that I'm being assessed on throughout the semester. There are plenty of other opportunities for me to keep improving and to keep learning and growing. And those thoughts, emotions are all enhanced by our frontal lobe, that prefrontal part, that regulatory part of our brain, and our hippocampus that has our memories and helps us put things into context. It can be difficult to activate these parts of the brain in periods of stress, right? And so practicing those cognitive techniques, reframing the situation, remembering we're in a safe context, leaning on others for support, that's all part of what's called cognitive behavioral therapy. And this is a form of talk therapy that people who experience anxiety and depression might engage in. And it helps you reframe those thoughts, feelings, and emotions that you're having so that when you are in these stressful circumstances, again, you can put things back into context. You can see past just this stressful moment, and hopefully you can mitigate some of those feelings of imperfection or failure.
For the AP Psych students out there, this is a lot of review with the brain. I'm hearing a lot of words like, frontal cortex, amygdala, hippocampus, and we're learning a lot of that in AP Psych right now. So it's really cool to listen to you talk about it.
Yeah, that's great that you're learning about it. And if you're enjoying that class, hopefully you'll consider our psychology and neuroscience programs at Wayne State.
Yeah. Okay, can you go more in depth about the brain's development during teenage years?
Yes, so we call the teenage years a sensitive period of development for the brain. This is a time where you probably notice you're growing and going through a lot of changes, and your brain is doing the same thing. It's an important period of time for the connections between different neurons, those are the cells that compose the brain, to form and to get solidified. So these are the pathways and networks that allow the different parts of your brain to communicate with one another and work in tandem. And we call those connections, those are axons that connect the cell bodies of neurons to the other neuronal cells throughout the brain. And what happens is these axons go through a process of white matter myelination or white matter development. So that's when the axons are being wrapped with layers of fat that protect the axons and help the information that region A of the brain is sending to region B to make that occur faster. So again, adolescence is an important period of time in which that white matter development is taking place and those connections are being established with one another. So this goes to the use it or lose it principle, this Hebbian principle that talks about what we do, what we experience, that's going to shape our development and how those connections get set up. So for example, when you're learning in school and you're practicing something over and over again, that's going to help your brain create a memory. Your neurons and the connections between them are actually going to change as you take in and learn new information. This is a period of time in which your frontal lobe also goes through some really important developmental stages. So the prefrontal cortex is a portion of that frontal lobe, and it's really important for helping you to regulate your emotions and helping you to regulate your reactions to stressful situations. The parts of our brains that allow us to go into that fight or flight state that you may have heard about before, those develop really early on because we want to make sure that if we're ever exposed to something dangerous or stressful or scary, we can respond appropriately to it. But when that development occurs a little bit more rapidly than that regulatory area, that means during our teenage years, we might be more likely to engage in some risk-taking behavior, or we might experience really, really big emotions. And it's all totally normal. It's all part of the process. And as your frontal cortex develops, you're better able to regulate some of those reactions. You have greater impulse control over time. And some of those emotions that might feel really big right now, they might dissipate in terms of the intensity of those feelings. So that means if you're feeling really stressed or really anxious about all these changes that you're going through in your life, not to fear, it will get better, it is going to change. And there are actually a number of tools and strategies that you can employ to help regulate your nervous system, to help regulate your brain, and to give that developing frontal cortex a little bit of a boost.
Can you give us more strategies to help us, regulate our emotions? And do you have any advice out there for the people who are struggling with mental health?
Definitely. So I work with younger kids too, so excuse my younger tone here, but we all have a superpower inside of us, and that is simply our breath. So if you think of doing deep diaphragmatic breathing, which I'll walk you through in a moment, what that's going to do is unlock your inner superpower to actually activate a nerve that helps calm down the fight or flight arm of your nervous system and helps boost the activity of that rest and relax aspect of your nervous system. And that's by physically moving the diaphragm to push on this nerve that's called the vagus nerve or cranial nerve 10. And the way that you can do that is by breathing in and out deeply through the nose. So if anyone here does yoga, this is Ujjayi Pranayama that they talk about, that deep yogic breath. And all you have to do is imagine you're filling up your stomach like a balloon when you inhale, and then squeezing all the air out when you exhale. You can always use your hands to help guide the breath and feel that movement. And if you're ever feeling stressed, you just need a break. If you could breathe in and out like that very deeply at least 3 times, that's already going to start calming down your nervous system. So this is an easy skill that you can employ wherever you are. But of course, if you need more support, there are so many things out there to help you cultivate your resilience and to help you overcome these challenges that you might be facing in your life. So you've got your school counselor that you can always talk to, of course, your family and friends for support. If you go on to the American Psychology Association's website, there are ways to find therapists you can engage with through talk therapy if you, your doctors, and your families find that that's something appropriate for you. There are also a number of different activities that you can engage in that might help bolster your mental health. So we know that exercise, dancing, creating artwork, playing a musical instrument, engaging in theater performance, practicing yoga, all of these things have benefits for both our physical and our mental health. And when we do them in a group setting, when we have that social support, that's even better for cultivating resilience and gaining all of those positive mental health benefits.
Amazing. And would you recommend students to take medication if they're dealing with anxiety or depression? And can you talk about what the medication does to our brain?
Sure, that's a very personal decision that's made between you, your family, your caregivers, and your physicians. Typically, this would be a primary care doctor, so maybe the doctor that you see every year, or perhaps even a psychiatrist, someone who specializes in the treatment of mental health conditions. So again, it's a very personal decision. And for some people, that decision can be really life-changing and supportive for them. Some of the most common medications that are used for anxiety and depression are called SSRIs, or serotonin selective reuptake inhibitors. And what this does is it makes more available in your brain a neurotransmitter called serotonin that's associated with feelings of positive mood, decreased depression when you have it in higher levels, and just overall feeling better, right? Feeling a little bit less reactive, maybe less likely for something to have a really big emotional impact on you. So these medications can help you feel in a more, what we would say if you learned this term in science class, homeostatic state, right? So everything is kind of at balance. It's exactly where it needs to be. So these medications aren't pushing you from one extreme to the other, where maybe if you're feeling really depressed or really anxious, they're not going to push you to feeling overly happy or overly energetic or enthusiastic, but the goal is just to get you back to that healthy baseline so that you can really enjoy everything that life has to offer. Of course, if medication isn't right for you, or if it's not something that you and your family are comfortable with or that your doctor recommends, then there's always those other options that I mentioned, like talk therapy. And that's also a big reason why I'm trying to do this research with my lab here at Wayne State on the benefits of creative arts and movement therapies, because we want that to be another tool in your toolkit for getting support for mental health and to cultivate resilience in your life.
Amazing. And I saw your Instagram page supporting this like art therapy. Can you talk more about that? I saw you in like the ice bath.
Yeah, so lots of different techniques that you can use. So I was taking a cold plunge the other day. I shared this on our lab's Instagram at r2la.b, at r2lab. So you can check us out. Please follow us.
I'll tag her.
Thank you. You'll get some great tips and tricks like the cold plunge tip that I was sharing. The idea there in cold plunging is that I was exposing my body to a stressful situation, but in a safe context. So I was practicing getting my body in that alerted state that's prepared to perhaps deal with something stressful. In this case, it was the cold, and that's a physical stressor. And that helped me to practice my tools, and it helped my body to practice its response to a stressor. So when I was doing that cold plunge, I was doing the deep breathing technique that I shared with you to help practice regulating my body under a stressful condition. And my body was also having a small inflammatory response. So the same type of response that you would have if you got sick, if you had a cold, the flu, something like that. My body had a small inflammatory response with that stressor, but then the stressor was alleviated, right? I practiced my deep breathing and I eventually got out of the cold plunge. And so my body was able to mount an appropriate response for being in a stressful condition, but then to bring that response back down, reset back to homeostasis, getting everything back in balance. So that's all helping me practice for when I encounter other stressful situations in my life. You can use techniques like that too to do so.
That's an amazing technique.
Yeah, and I know you were also asking about art therapy. So we can engage in art as therapy, again, as another technique we can have in our toolkit. Maybe we find it really relaxing to draw or work with clay, to paint, whatever medium that we enjoy. There's also a field called art therapy in which individuals train at the master's level, so they get a graduate degree in art therapy, and they learn how to become a therapist. So very similar to a social worker, to your school guidance counselors, to psychologists who have that clinical training, and they specifically learn how to use art as a tool to better understand someone's lived experiences, the mental health experiences they might be having, and to use as a treatment. So we've used art therapy very frequently with children and with their families. We've done a lot of work specifically with families who have resettled as refugees from outside of the United States, so places like Syria, Iraq, Afghanistan, the Ukraine, the Democratic Republic of the Congo. We've used these techniques to, again, help build resilience, doing them in a group setting, feeling closer with your peers, your family members, and again, to process some of those emotions. So many people who have the experience of resettlement might have gone through a number of different traumatic or stressful life events. And the goal of our art therapy programs is to help individuals non-verbally process those stressful and traumatic thoughts, feelings, memories that they may have, and then to grow through those experiences, and again, to cultivate resilience, to improve mental health, to reduce symptoms of post-traumatic stress or anxiety that individuals might be facing. So one that you could do at home, we always start with kinesthetic, so movement-related types of activities in art therapy to just engage the body, not even talking about emotions yet, just moving slowly with the body. You can practice putting on a song that you enjoy, maybe something with a low beats per minute, something more relaxing, and just practice drawing with the beat of the music, or even drawing with your breath if you don't have music on hand. And just practice moving the pencil along the page, not lifting the pencil, and just engaging in that relaxation period. When you eventually lift the pencil away, you can see if there are any patterns or shapes that you find in your image that you might be able to fill in, and then think about the image that you've created here. Another technique that's pretty easy to do at home is to make a meditation jar for yourself. That again can be a tool that you've always got on hand. So if you take a little bit of clear Elmer's glue and mix that with water and put it in a mason jar, and then you can add in food coloring or dyes of your choice, and then maybe some sparkles, little trinkets that you might have that make you smile or that represent parts of you that you're really proud of or excited about. So if you have a little soccer ball charm or a ballet slipper or something like that, or maybe even you have a little brain squishy from participating in one of our research studies, you can put that in there and just shake it up whenever you're feeling stressed. Watch the glitter fall and settle, watch the objects move around in your jar, and use that as a focus for your meditation, just to look at what color is in the jar, how is the water moving, how slowly or fast are the objects moving within the water, and use that to anchor yourself to the present moment.
I know for me, I get really busy, especially with school and extracurriculars, and it's hard for me to find time to even like sit down and journal and just like breathe. So do you have like advice for students out there who are going like handling a lot, who are really busy? Like how can we also balance self-care?
That's so important, and it's so important at any age and stage. What I do is I put it in my calendar. So just like you're making time for sports practice, for studying, put it in your calendar that this is 10 minutes that you're going to take for yourself to do a self-care practice. Even if it's just 10 minutes a day, that's a great benefit to you. And block off that time, protect that time for yourself. I think that's really important. If you're also able to integrate these practices into the time that you spend with your friends, maybe you make those meditation jars together, for example, or maybe you go on a walk together when you're catching up instead of just hanging out at someone's house, you're walking and moving your body. You can integrate the practices into your daily life. So even with your busy schedule, you're multitasking, you're doing self-care, but you're also hanging with your friends. Or maybe you're studying while you're simultaneously sitting outside in nature and just enjoying breathing the fresh air. And that way it just becomes a part of your daily life and not something that feels like, I have to make time for this, I have to do this. And that's why, again, I offered so many different strategies, because everything will work differently for each individual person. There might be a self-care strategy that you really enjoy that I don't, and that is totally okay. That's why it's important to find something that works for you. If you're sitting here and thinking, I don't like art, I don't like dance, that's okay. You don't have to engage in those practices in order to cultivate resilience. You know what makes you strong, healthy, and happy, so make your self-care doing whatever that is.
Do you have any advice or words of wisdom for the teenagers listening out there, or like an inspiring quote that stuck to you?
Yeah, you're faced with so many life decisions at this point. You really know yourself better than anybody else. When I was faced with some big life decisions a little bit later in my stage than where you all are at now, but when I was going to graduate school, I had these ideas about wanting to help people with art therapy and dance and movement therapy, and lots of people told me, that's not gonna work, do something else, try to fit in with what everyone else is doing in the scientific community. And I said no, because that wasn't true to me and it wasn't what I wanted to do. So I think that you all have big ideas, big goals, and I hope that you won't change them to fit in with somebody else or what everyone else is doing. Stay true to yourself and make the choices that serve you best and feel right to you. Because I made that decision, we've now helped over 900 people across the state of Michigan with these arts and movement programs. We've made a big, long-lasting impact over the past 7 years, and it was a team effort for sure, and we wouldn't have embarked on it if we had listened to all the naysayers.
That's amazing. Thank you again, Dr. Grasser, for being on our podcast.
Thanks for having me, Vanessa.
It was a privilege and an amazing opportunity. If you guys have any questions, please DM us at perfectlyimperfect.hosa, and I'm going to tag her lab account as well.
Thanks so much.